My name is Arno Stenzel. I'm a urologist and uro-oncologist at the University of Tübingen in southwestern Germany. I'm there a senior professor, and at the same time, I am a clinician and a consultant at a hospital in Stuttgart. I am on the same time, I am the Secretary General of the European Association of Urology. In that role, we are trying to increase our dialogue with Chinese colleagues, among other uh, areas worldwide. And as thus, it is a pleasure to support the current Urology Journal as a way of increasing the dialogue between European and worldwide researchers and clinicians and their Chinese colleagues. Well, current urology is a strong journal in China, and China has excellent academic and clinical researchers, urologists, clinicians, and their work should be made public to not only in China but also to an international audience and or readership. And that should be the goal. And on the same time, there should be an exchange allowing maybe future collaboration with colleagues in Europe and other parts of the world. Because only together with networks, we'll be able to have a strong community getting knowledge and getting ways of treating our patients better in the near future or in the distant future. And I think, again, that the excellent work of Chinese researchers should be made, should find its way into the international community. And on the other hand, there should be possibilities that people from all over the world doing excellent research as well will bring their knowledge and their results of their academic or clinical research into China, into a Chinese community, and thus both sides helping to improve the fate of the patients and also getting research to a higher level, which can only be done together. For a strong manuscript, there should be a timely topic. There should be a flawless methodology and statistics. Statistics can be then in-house controlled or see whether it has all the right tools used. And of course, the message. The message should be based on the methods, based on the results. And on top of that, if the submitting researchers are not native English speakers, that should have an English editor look over that. Well, current urology is a very strong and one of the leading journals in China. And of course, those doing their research and in China, that would be a nice way of having their work read and discussed internationally, not only in China. And on the other hand, international clinicians, researchers, they should submit their work in order to have it then seen in China and also discussed in China, and really create a dialogue on that respective research field. I think in 5 years from now, it should be the leading Chinese urological journal with a international visibility, something that should then lead to an increased dialogue between clinicians and researchers, between China and others worldwide. And it should have an impact factor and allow researchers to increase their not only impact factor but also H-score, and to be seen beyond China on an international stage with really success in their research worldwide.